A patient today asked about gabapentin or Neurontin. Gabapentin is a medication that's been used for quite a bit of time for certain conditions with pain. So diabetic neuropathy, fibromyalgia, post-herpetic neuralgia, and other pain conditions. It also is used in seizure disorders for certain individuals, and it can also have an effect in terms of helping individuals who are dependent on alcohol, decrease their alcohol intake, or can prevent some of the serious withdrawal symptoms that can occur from stopping drinking when someone drinks too heavily. With that being said, it's advised, there's caution on in the package insert about not using with alcohol, and so obviously if you're going to be taking this medication, just like any medication, you need to be under the direct supervision of a medical provider to make sure that you're taking it in a safe way and that someone can help you with regards to appropriate ways of taking it for your specific condition. Gabapentin works by blocking calcium-dependent voltage channels in the central nervous system, which doesn't really tell the average person too much. But basically, it's going to increase GABA levels, which are your major inhibitory neurotransmitter in the central nervous system, to calm down or decrease the excitation of neurons. And when I think about excited neurons, although this might not be completely medically sound, I think about excited neurons equating to anxiety, mania, seizures, and alcohol withdrawal symptoms or withdrawal symptoms. And so you can see that by increasing neurotransmitters that calm neurons, this medication is used or maybe applicable for individuals with seizure disorders and bipolar disorder and anxiety, off-label and pain syndromes. Gabapentin is a medication that may be preferred for pain medications over some of your more traditional opiate pain medications, so it may have a lower risk for abuse and dependence and tolerance and withdrawal. But with that being said, it is a controlled medication in many states, and it does have some abuse potential, and it can cause a physiological dependence. It also can be used off-label for certain anxiety disorders or difficulties with anxiety. And it sometimes is used to help with insomnia, off-label as well. But again, with that being said, this is a medication that can have abuse potential. And while I may prefer it for many patients to your benzodiazepines like Xanax and Valium and Klonopin and Ativan, because I believe that it has less abuse potential than some of those medications, it still has abuse potential, and so you need to be very careful about taking this medication and make sure you're taking it directly as prescribed and under supervision of a provider. Gabapentin can also be used to help individuals going through alcohol withdrawal, as I mentioned before, but if you read about warnings with this medication, some of the warnings listed include to not take it if you're drinking alcohol, because it can decrease your respiratory drive or cause sedation, which could compound with alcohol and could cause some significant side effects or problems. So again, that's why all these medications, you've got to be very careful to make sure you're under the supervision of a provider. I'll talk a little bit more about gabapentin elsewhere. If you believe that this video pertains to you in any way, please be sure to speak to a mental health professional directly, as these videos are just meant to be informative only and increase discussion about mental health topics.